Rhode Island is facing a terrifying epidemic. We have one of the highest rates of teen substance abuse in the country. When mental illness is also part of the picture, the outcomes are frighteningly poor. %80 of kids who abuse drugs also have a psychiatric illness.
I got into self-medication over the fact I was getting bullied so much, and when you get so much negativity thrown at you, there's only so much you can handle.
They made fun of his hands. They made fun of the fact when he was absent a lot because he was sick. They made fun of the way he looked, if he slouched, his arms not being the same. They would call him alien. You know, it took a huge toll on him because he would just brush it off and just went to school with a smile all the time. But eventually, you know, the smile went away. He had 3 major surgeries, and the anxiety of missing school, not being able to be in sports anymore. He sought relief in other places, and it just went downhill from there.
A bad day for me would be getting in the littlest argument with my mom, which led to me punching holes in the walls, freaking out, which then I started taking Xanax or whatever. Then I could barely talk or walk for 6 hours, and then I would pass out wherever I last was.
Recovery for anyone is very, very difficult. For an adolescent, it's pretty critical. And unfortunately, there aren't a whole lot of programs in Rhode Island to support that. And that's just unacceptable, really.
There's so many people out there with mental health issues that look for that release with the drugs. You know, you want to mask your pain, you want to mask your anxiety, you want to mask your depression. You're going to mask it with drugs.
The way that treatment within Rhode Island for youth with co-occurring disorders exists is that we really have to put together a hodgepodge package that addresses their needs. However, none of them particularly address the entirety of the co-occurring disorders. We're really looking to create a high-quality program in-house and no longer have to rely on sending people out to be able to provide those services for youth and their families here. We are very excited that the Intensive Outpatient Program for co-occurring disorders has been selected to be part of the Bravo Bradley funds. And those funds would be used to provide a variety of startup costs for a program of this nature. This program is in part an outgrowth of calls that we receive pretty regularly from very, very worried parents. And they're worried about their kids' safety, they're worried about their kids' substance use, and the outpatient programming just wasn't meeting their needs. It actually is a really difficult call to take when you're talking with parents and you really don't have a great direction to send them. And so I'm really excited about this program because it actually allows me to pick up the phone and be able to say, yeah, I know where to send your kid.
Bradley's a wonderful hospital. They have fantastic staff and wonderful doctors. We're very lucky to have that facility here in Rhode Island.
For kids like Ben, this program is the missing piece in the continuum of care puzzle.
I'm most proud that I'm still here, to be honest with you. For a while, didn't really think that I'd be this far in life. To be honest, thought I'd be dead. And I'm proud of that. I'm very proud. Thank you for all the help, because it helped me a lot.
You took it, you were open to it, and that's what really made this happen for you.